news. Every year, more than 200,000 people tear their ACL in their knees. But Doreen Getzler is here with details on a new procedure to treat that injury. Doreen?
Chris, that's right. ACL tears are actually pretty common, and they happen all the time to athletes, and they can be excruciatingly painful. It almost always requires surgery with a long recovery time, but an innovative and less invasive surgery is significantly cutting down on recovery time, and patients who have had it are pretty happy with the results. Kaniya Brown almost wasn't able to run this race.
Some scholarships were lined up for her for track and field, but they all sort of went away when they found out that she had torn her ACL. And she said, "Doc, the only way that I'm going to have a chance to get my scholarships back is if you let me compete in the Penn Relays." And so I was looking at the calendar and I said, that's about 4 months away.
Kaniya was a high school senior when she got hurt in a soccer game. She was also on the cheerleading squad and ran track and field. The first doctor she saw immediately after her injury painted a bleak picture.
He told me from there I wouldn't be able to run again and I wasn't going to be able to go back into sports. I didn't really want to talk to him or hear anything else he was saying.
Kaniya's father brought her to see Dr. Duogi at MedStar Washington Hospital Center in D.C. After years of accepting ACL reconstruction as the standard, Dr. Duogi started looking for better ways to treat the injury.
I went to Dr. Duogi. He discussed with me and my dad that it was a new procedure the doctors was doing. All I knew about the surgery was it was supposed to cut recovery time in half and I would be able to compete in Penn Relays. So from there, I went into surgery.
Conventional ACL surgery rebuilds the anterior cruciate ligament using tendons from another part of the body to replace the ligament. It has been the most commonly used surgery when repairing ACL injuries, and recovery can be slow and painful.
Over the last 10 years, we've embarked on projects to do better studies, and what we're finding is quite sobering. We're finding that after ACL reconstruction with conventional methods, that only 43% of high school and collegiate football players are able to return to play at the same level.
Duogi heard about a procedure being done by a doctor in Scotland in which an internal Kevlar lace suture was put inside the knee. After seeing the doctor's increasing and lasting success in treating ACL tears, he flew the doctor to the United States to learn the procedure. He's performed the surgery on 26 patients in a year and a half. As for Kaniya, she's a freshman now at the University of Maryland Eastern Shore, running track for the Hawks. And in a recent meet,
for my surgery, my times were good, but I actually dropped seconds off of my time.
Did you hear that? Her time is faster now than it was before the knee injury and the surgery. Kaniya will be heading back to school in a week. She plans to run track this spring. Sounds like there's no stopping her now. Chris, Wendy?
Yeah, thanks, Doreen.
Sure.